Jeff, as you well know, is the author of the current nonfiction bestseller, The End of Poverty, and has written extensively on issues of health, poverty, and development. A native of Detroit, Michigan, which you'll hear from his accent, Jeff received his BA, MA, and PhD from Harvard University, although the accent doesn't show there. And Jeff, let me just say before turning it over to you that this room is literally, you can't see it, but it's literally overflowing. It looks like a Calcutta bus. So I think it's a perfect opportunity to hear your comments on this.
Great. Nils, first, thank you so much for the honor of launching this report at the Global Health Council annual meeting. We're really thrilled. There is no more appropriate place on the planet but to launch this report, and congratulations on another spectacular meeting under your leadership, and for all your leadership, Nils. We're really tremendously in your debt. We're also in debt to Stan Bernstein, who has led this team with a lot of bravery and fortitude, and through a lot of the thickets of international politics on this issue, not only during his time as leader of these issues at the UN Millennium Project, but for many years before that, and we know for many years to come. Stan's leadership is really unparalleled, and this is a wonderful report that he and his team have put together, and I'm so proud to be associated with it. I'm also joined by our lead on health policy of the UN Millennium Project, Dr. Derry Keneal, who is going to also, I think, make some interventions about community health workers and some of the things that we're discussing actively now in terms of implementation of agenda items on health in general, disease control, and certainly on the sexual and reproductive health issues of this report. Everybody knows this is a highly political topic, and it is the case that if you read the 8 Millennium Development Goals, you will not find sexual and reproductive health anywhere on the page. But what Stan said is really the essence of the issue. There isn't a chance in the world to achieve the Millennium Development Goals unless sexual and reproductive health services are front and center. And that's true of all of the goals. It's obviously true of maternal mortality, which is one of the stated and central goals, because without sexual and reproductive health, without access to emergency obstetrical care, without access to safe and effective contraception and the like, there's just not a chance in the world to meet that. But what the report does beautifully is to show that every one of the goals, from poverty to universal education at the primary level, to gender equity, to reducing maternal and child mortality, to disease control, of course, AIDS, but also other diseases, to overcoming challenges of extreme hunger, environmental degradation as it relates to population. All of these goals require not only a greatly stepped up access to public health services and to emergency medical services when those are required, but also specifically to sexual and reproductive health services. Now, I said at the beginning of the UN Millennium Project that everything that is required to meet the Millennium Development Goals is part of the UN Millennium Project. Because otherwise, if you will the way, you have to will the means to do it. And that means that sexual and reproductive health is there, whether or not it's literally there in the words. And so right from the beginning, as many activists and others expressed skepticism about the Millennium Development Goals because it seemed that the ICPD agenda was gone and that they had been beaten out of the goals, I always encourage people, please be calm. No one's beating away central elements of a successful agenda to fight hunger, disease, and extreme poverty. And this is, I think, given evidence by today's wonderful report, we are absolutely keen to make sure that sexual and reproductive health services are front and center of national development strategies to achieve the Millennium Development Goals. They have to be. And the logic is impeccable. The evidence is overwhelming. And of course, it's been a hallmark of the UN Millennium Project, and this report is no different. The report is not just to say what's important and not to say in general terms what to do, but actually to get practical, time-bound, quite specific, and Stan already illustrated what are these sexual and reproductive health services that are so much central, whether it's emergency obstetrical care, access to contraception, access to family planning, access to prevention and control of sexually transmitted diseases, and access to both protective legislation and public outreach and change of public attitudes regarding violence against women and other areas. All of this is central to achieving any of the Millennium Development Goals. I want to say one word, not about all aspects of this, but about one point on population, which Stan alluded to, which as a development economist and as a macroeconomist, I find to be very important. I think it's underemphasized, but now I'm seeing in the context of some of the poorest countries a change of policy, and I think it's important to recognize. Everybody in the room, I'm sure, is familiar with the concept of the demographic transition, and that is the transition of societies from high mortality and high fertility rates to low mortality and low fertility rates. The demographic transition has been a core part of all successful economic development strategies in any successful part of the world since modern economic growth began 250 years ago. Now, like most things about modern economic growth, the demographic transition proceeded gradually in the first cases in the UK or Great Britain at the time, or in the United States or other early industrializers. The demographic transition has been shortened in its duration in modern decades, just as economic growth and development has accelerated for the successful countries in recent decades. The reason why the demographic transition and economic development have gone hand in hand is also analytically quite clear. First, if mortality rates remain very high, if the death rates remain high, the lack of productivity in the economy, the amount of investments that are made but never brought to fruition because of deaths of children, sicknesses of adults, becomes overwhelming. So poor health itself, as we increasingly understand, becomes a direct impediment to economic development. So good health is a major investment in economic success. But suppose you reduce the infant mortality rates and the child mortality rates, but fertility rates were to remain high. Then, of course, the consequence is twofold. One is a massive bulge of population, which in some contexts might be acceptable for a while, but the sheer power of geometric progression, as was pointed out 200 years ago, eventually gets to you. So you can't have the mortality rates coming down and the fertility rates remaining high for generation after generation without courting disaster.